Hello everyone, welcome back to my channel Untangle ENT. Hope you have mastered pure tone audiometry now and you can interpret pure tone audiograms very easily and answer in your vivas as well as diagnose patients. So now let's learn about impedance audiometry. So what is impedance audiometry? It is an objective test of hearing that measures the resistance offered by the tympanic membrane and the medullary cavity, and it consists of a tympanometry and acoustic reflex. Through this video, we will first learn about tympanometry and we will talk about acoustic reflex in a separate video. Let's learn about the principle of tympanometry. Imagine this cylinder to be your external auditory canal and this thing as your tympanic membrane. Now, when the sound hits the tympanic membrane, some sound gets absorbed and some is reflected back. In tympanometry, the EAC is sealed and thereafter the pressure in the sealed EAC is changed and when the reflected sound is measured. The sealed EAC has a pressure which ranges from minus 200 mm of water to plus 200 mm of water. Now the sound comes, it hits the tympanic membrane, some is absorbed and some part is reflected. The reflected sound is measured. Now this sound is interpreted through tympanometry. What are the equipments required for tympanometry? We need oscillator, a microphone and air pump. Oscillator is the one which delivers pure tones at 226 Hz. Microphone is that which picks up the reflected sound that is being measured, and the air pumps which keeps changing the pressure in the external auditory canal. Now these three are present in a single probe which is inserted in your external auditory canal and thus the tympanogram is generated. Before we learn about the interpretation of tympanometry, let's learn about the basics. This graph is the tympanogram, which is the air pressure and compliance graph. The x-axis represents the pressure measured in millimeter of water and y-axis is the compliance measured in ml. Now this pressure ranges from minus 200 to plus 200. The dictum here is more the sound is reflected, less is the compliance of the tympanic membrane. Now let's learn and understand the basic. The normal medullary pressure with normal eustachian tube function is 0 to minus 150 mm of water. See the image. Let's imagine the cylinder to be the sealed external auditory canal. This is the tympanic membrane and this is the medullary cavity. Now suppose the air pump pressure is 0, that is similar to the medullary cavity. The stiffness of the medullary system is normal. Therefore, when sound hits the tympanic membrane, absorption is more and reflection is less due to the normal stiffness of the system. Therefore, we get the highest compliance of the tympanic membrane and the medullary cavity system. But when the air pump pressure is minus 200, there is a negative pressure in the external auditory canal than the normal medullary pressure. Therefore, the stiffness of the system gets altered, reflected sound is more than absorption, and thus the compliance is very less. Again, when we increase the air pump pressure to minus 100, which is nearly similar to the medullary cavity, the reflected sound decreases but the compliance increases as the stiffness of the system gets better. Now when the air pressure pump is made 0, we get the highest compliance because of equal air pressure in both the cavities and normal stiffness of the system. But now when the air pressure pump is made to plus 100, here the external auditory canal pressure is very more than the medullary pressure and thus the stiffness of the system is altered, TM get pushed inside and the reflected sound increases, absorption decreases and thus there is decrease in the compliance. Similarly, if we increase the pressure more to plus 200, again the compliance decreases of the system. Thus, when we plot this variation of compliance with the pressure, we get this type of graph which is known as the type A curve, which is a normal curve which represents the normal medullary function. Now let's see a different scenario here. Now imagine there exists some pathology with the stiffness of the medullary system, which can be otosclerosis or ossicular fixation, where there is already altered stiffness, there is increased stiffness and less compliance of the tympanic membrane. So when the air pressure pump is at minus 200, sound reflection is more and the compliance is less. Air pressure pump at minus 100, compliance gets better. But when the air pressure pump is at 0, we get the highest compliance, but the peak of the compliance is very less compared with the normal condition. The reason is the stiffness of the system is already altered because of pathology like otosclerosis. The compliance of the system is altered, the compliance is also already deformed. Therefore, even at a similar air pressure externally and internally, the compliance peak is less. Now again, when we increase the pressure to plus 100 or plus 200, the compliance decreases. Thus in this, we get a graph like this, which is called as the AA's type of graph, which is normal curve with low compliance. It is seen in ossicular fixation, otosclerosis and tympanosclerosis. Now let's see another scenario. Imagine there is a lax tympanic membrane or less stiffness of the medullary cavity, such as we can see in ossicular discontinuity. Now see the image. Now this is the tympanic membrane and consider it very lax, very thin. So what will be the consequences? Suppose the air pump pressure is minus 200, which is more negative than the medullary pressure. So in that case, the reflected sound is very much, as the tympanic membrane is very lax, and the most of the sound is getting reflected, so the compliance is less. Now when we take the pressure to 0, now this is similar to the medullary pressure, then the system stiffness is maintained, but as there is a pathology in the system, there is a lax TM or there is ossicular discontinuity. But when the air pump pressure is 0, the ESC and the medullary are having nearly same pressure, the stiffness of the system is very less here, and the compliance is highest in this condition as the reflected sound is very low. The TM is thin and there is ossicular discontinuity, but an equal pressure, the sound totally gets absorbed and there is no reflection of the sound, and therefore we get a very high compliance, almost an unending peak. But as we increase the pressure, the outer pressure is more than the inner pressure, the TM gets pulled inward, and therefore in this condition, the reflected sound is more and the compliance slowly decreases. So when we increase it to 200, there is more increased outer pressure and the reflected sound is more and the compliance is totally decreased. So in this condition, we get a graph which is called as the AD type of graph. This is the graph we get. It represents a high compliance at a normal or a near normal pressure, and this is mostly seen in case of ossicular discontinuity, lax or thin tympanic membrane. Now let's say another condition. Here there is negative medullary pressure due to some pathology like eustachian tube dysfunction, where the negative pressure is normally 0 to minus 150. Now let's assume the negative pressure is around minus 160, which is more than the normal negative pressure of the medullary cavity. Now in that case, if the air pump pressure is made as minus 200, the TM bulges and there is more of reflected sound and less of absorbed sound, and there is compliance is less. Now when we make the air pressure to minus 180, which is nearly normal to the negative condition, that is minus 160 of the medullary, in that condition the compliance increases. Now when the air pressure is made at minus 160, which is similar to the pathological medullary pressure, that is around minus 160, then the tympanic membrane is normal, the stiffness is intact and the system works functionally, then we get the highest compliance. Next, again, when we increase the air pressure, that is 0, there is more pressure in the external auditory canal than the medullary, and thus TM again gets pulled inward. And in that condition, the compliance decreases as the reflected sound is more. And then with an air pressure of plus 100, and then again the reflected sound are much higher and the compliance decreases. So in this condition, we get a graph like this, which is called as a type C graph. So what it is a similar to the normal graph, but the peak appears at around minus 150 instead of 0 pressure. And this is mainly seen in case of retracted tympanic membrane, which is seen in eustachian tube dysfunction cases. Now let's see the last scenario. It is a condition where there is fluid-filled medullary cavity. So when the sound travels from the external ear into the medullary cavity, there is no absorption of sound and there is maximum reflectance of the sound, and there is no such compliance change even if you change the pressure of the external auditory canal. Even if the pressure increases, decreases, there is no change of compliance as the sound is not traveling properly inside and maximum sound is getting reflected back. So in this case, a graph is obtained. This is the type B graph where there is no specific peak at any specific pressure. This is known as the type B graph, which is called as a flat or dome-shaped curve with no change of compliance with pressure. This is seen in fluid in medullary cavity like otitis media or in serous otitis media or in case of thick tympanic membrane. Now here is a quick recap. A is a normal curve where there is normal medullary function, normal stiffness of the system. AS type is a normal curve with low compliance, which is seen in ossicular fixation and otosclerosis or tympanosclerosis. Now here's a trick. This you can remember this S as sclerosis, so there will be a small graph. Now next is AD, which is high compliance, seen in ossicular discontinuity or a thin tympanic membrane. Now we can also think as D as discontinuity. Discontinuity means high compliance. Next is a B-type graph, which is flat or dome-shaped graph, which is seen in medullary fluid or otitis media with diffusion of the tympanic membrane, where there is flat graph. And the last is C-type graph, where there is maximum compliance occur at a negative pressure because of the retracted tympanic membrane. Type A, this is type B, this is type C, and this is type AS, and this is type AD. Now, here are a few charts for you to examine, understand, and interpret. Please give your answers in the comment section. And if you have liked this video, please like, share, and subscribe to my channel Untangle ENT. Thank you.